Here I will discuss the mechanism actions of fentanyl analogs. First of all, fentanyl. Fentanyl is similar to the opioid drugs. Fentanyl molecules target a subclass of opioid receptor systems in the body, many of which are localized in the brain within specialized neuroanatomical structures, particularly involving the control of emotions, pain, and speaking to the point of its infamous addictive properties. Biochemically, it is a mu selective opioid agonist. However, it has the capability to activate other opioid systems receptors such as delta and potentially the kappa receptors. Consequently, the activations of these receptors, particularly the mu receptors, produces analgesia. The new neurotransmitter dopamine is increased in the reward areas of the brain, which elicits the stereotypical accelerations and relaxation effects, which is typically associated with the addiction to the drug. Mechanism actions of alfentanil. Opiate receptors are coupled with G protein receptors and affect functions as both positive and negative regulators of synaptic transmissions via G proteins that activate effector proteins. Binding of the opiate stimulates the exchange of GTP for GTP. GTP stands for guanosine triphosphates and GTP stands for guanosine diphosphates on the G protein complex, as the effector system is adenylate cyclase and clamp located at the inner surface of the plasma membrane. Opioids decreases intracellular clamp by inhibiting adenylate cyclase. Subsequently, the release of nociceptive neurotransmitters such as substance P, GABA, dopamine, acetylcholine, and noradrenaline is inhibited. Opioids also inhibit the release of vasopressin, somatostatin, insulin, and glucagon. Alfentanil's analgesic activity is most likely due to its conversion to morphine. Mechanisms of actions of surfentanil. Surfentanil binds very strongly to mu opioid receptors and acts as a competitive agonist. Opioid receptors are coupled with G proteins receptors and functions as both positive and negative regulators of synaptic transmissions via G proteins that activate effector proteins. Binding of these opiate stimulates the exchange of GTP for GTP on the G protein complex. As the effector system is adenylate cyclase and clamp located at the inner surface of the plasma membrane, opioid decreases intracellular clamp by inhibiting adenylate cyclase. Subsequently, the release of nociceptive neurotransmitters such as substance P, GABA, dopamine, acetylcholine, and noradrenaline is inhibited. Mechanisms of actions of sufentanil. Sufentanil is synthetic potent opioid with highly selective binding to mu opioid receptors. These receptors are widely distributed in the human brain, spinal cord, and other tissues. In general, opioid decreases clamp, affected neural signaling pathways, decrease neurotransmitters release, and cause membrane hyperpolarizations, all of which contribute to the relief of painful symptoms. Opiate receptors are coupled with G protein receptors and functions as both positive and negative regulators of the synaptic neural transmissions via G proteins that activate effector proteins. Binding of the opiate receptors leads to the exchange of GTP for GTP on the G proteins complex, as the effector system is adenylate cyclase and clamp located at the inner surface of the plasma membrane. Opioids decrease intracellular clamp by inhibiting adenylate cyclase. Opioids close n-time voltage operated calcium channels or P2 receptor agonist, also preventing neurotransmitter release. Sufentanil and other opioids open calcium dependent inwardly reactifying potassium channels, resulting in hyperpolarization and induced neural excitability. Mechanisms of actions of remifentanil. Remifentanil is mu opioid agonist with rapid onset and peak effect and short duration of action. The mu opioid activity of remifentanil is antagonized by opioid antagonists such as naloxone. Here, the medical uses of fentanyl analogs. Fentanyl analogs are synthetic opioids that are chemically similar to the fentanyl but have been designed to circumvent drugs laws and regulations. Fentanyl is a powerful synthetic opioid that is used medically to treat severe pain. Fentanyl analogs have been used in medical settings for pain management. They are also used illicitly as recreational drugs. Anesthesia. Intravenous fentanyl is often used for anesthesia and as analgesic. To induce anesthesia, it is given with a sedative hypnotic like propofol or thiopentanyl and a muscle relaxant. To maintain anesthesia, inhaled anesthetics and additional fentanyl may be used. They are often given in 15 to 30 minutes intervals throughout procedures such as endoscopy and surgeries and in emergency rooms. For pain relief after surgery can use decrease the amount of inhalations anesthetic needed for emergence for anesthesia. Pain management. The bioavailability of intranasal fentanyl is about 70 to 90, but with some impression due to clotted nostrils, pharyngeal swallow, and incorrect administrations. For both emergency and palliative use, intranasal fentanyl is available in doses of 50, 100, and 200 micrograms. In emergency medicine, safe administrations of intranasal fentanyl with a low rate of side effects and a promising pain reducing effects was demonstrated in the prospective observational study. Observational study is about 900 out of hospital patients. In children, intranasal fentanyl is useful for the treatment of moderate and severe pain and is well tolerated. Furthermore, a 2017 study suggested that efficacy of fentanyl analogs in children as young as 5, weighing as little as 13 kilograms. Adverse effects. Fentanyl's most common side effects, which affect more than 10% of people, include nausea, vomiting, constipation, dry mouth, confusion, and anesthesia. Less frequently, in 3 to 10% of people, fentanyl can cause abdominal pain, headache, fatigue, anorexia, and weight loss, dizziness, nervousness, anxiety, depression, flu-like symptoms, dyspepsia, shortness of breath, hyperventilation, apnea, and urinary retention. Fentanyl uses has also been associated with aphasia, despite being a more potent analgesic. Fentanyl tends to include less nausea as well as less histamine mediated itching than morphine. The duration of action of fentanyl has sometimes been underestimated, leading to harm in a medical context. In 1906, the United States Foods and Drug Administration began investigating several respiratory deaths, but doctors in the United Kingdom were not warned to the risk of fentanyl until Receptor 2008. The FDA reported in April 2012 that 12 young children